I stopped talking for almost 9 months, and recently the staff have been really supportive of it, and I've started talking again, and they're really helpful with it, and they don't push me, and they're just genuinely happy to see me speaking again. But being here, I've met some of the most amazing nurses and support workers and just amazing staff members who genuinely make a difference in people's little lives. And I wanted to do that one day. I want to one day be able to help people get their lives back on track and help them get through their difficulties.
I'm just focusing on getting better now to get home.
Yeah, and that's the aim.
Yeah, and then just go to college, and staff are really supportive, because I thought I was too stupid to go, and then staff kind of just laughed at me and was like, whatever, you're clever, come on, we can do this, and pressured me into it. But I'm so grateful that they did, because they had my best interest at heart. There's a lot of times I don't feel comfortable being like, oh, I'm sad, I need help, but they recognise when I'm sad, and they've taken the time to watch my movements, see how I react to stuff, to notice, even because I'm really good at hiding stuff, so for them to be able to know when I'm sad it's a really big thing for me.
When we closed, we had a cohort of young people that we didn't have anywhere for them to go, and really they needed to go home, but there wasn't a service in place that could manage their levels of risk at home. So we created a home treatment team, and we provided inpatient care to the young people at home, and we had such good outcomes from that we decided to create, within the new model, we decided that we would have a home treatment team as part of the offer.
The home treatment team is a 24/7 service, so we work 24 hours a day, and we provide a hospital at home model. So we see young people in their homes, in their communities, and what we want to try and promote is preventing hospital admissions, as well as reintegrating the young people back into their communities as much as possible by going back to school, being around their families, empowering their parents to care for them.
The home treatment team, I always used to despise them, but with my previous admissions, they're amazing people, and if I don't want to see them, I don't get a choice. Whereas before they'd be like, all right, don't see us then, but now they just turn up at my house. It's just like, well, we're here anyway. Yeah. And it's just amazing. I always have a primary nurse called Ellie on the home treatment team, and she's always my nurse, and I'm so grateful for it, because she knows me 100%, and she gets everything. It's if I don't want to talk on the phone, she'll text, but she's just an amazing human.
I would like to think that we could roll the home treatment team model out more widely. It's a no-brainer for me to, and I would like to think that the commissioners would start to think that that's how services need to be approaching things in terms of increasing capacity in the system. But I think we'll have to wait and see.
What do your kind of family and friends think about you working here?
Oh, they're super proud now. I think my family and friends, when I came here, I've always had a love for CAMHS, and I've always wanted to be a nurse, so they've always supported my career. But when I came here and it was in the mess that it was in, I think my family were quite concerned. You know, there was a lot of restrictive measures, like lots of control and restraint. There was quite a lot of violence and aggression on the ward, you know, so I'd get bumps and bruises. But then obviously when we turned it around, they're, you know, what I've achieved, they're super, super proud. So, and I'm proud because obviously I've made them proud. So. Young people shouldn't be in hospital, teenagers shouldn't be in psychiatric inpatient units, they should be at home with their families and with their peers and at school and doing things that normal teenagers do. So I think that's where you get the outcomes from, because they don't become institutionalised, they're not stuck in hospital.
I think there's always going to be a time where you find a really difficult patient and you don't know how to help them, and as much as you try, you can't seem to find anything which will help. But if you just sort of keep on trying, and then one day you get a little leeway one way, and everything can change, and then they could just get so much better, and that's because of you, and that's because you didn't give up on them. And I'm really glad that no one here has given up on me yet, and I think that's just what I needed.